Stopwatch. Okie dokie. Welcome to the IV and medication skills test. We'll be testing at the paramedic level today. These skills are designed to evaluate your ability to establish venous access in an adult patient and administer an IV bolus of medication. You'll be given a patient scenario and will be required to establish an IV and administer an IV bolus of medication just as you would in the field. You will have 3 attempts in a 6-minute time limit to establish the IV. If you do not successfully establish an IV, you'll be unable to administer the IV bolus of medication to the patient. Although you're using a mannequin arm, you should conduct yourself as this were a real patient. You should assume I'm the actual patient and I may ask any questions you would normally ask a patient in this situation. After you establish the IV, you will have 3 minutes to begin IV administration of the bolus of this medication. You have any questions about the scenario or your equipment?
I do not.
Alright. Your patient will be treating as a 60-year-old male who's bradycardic, pulse of normal sinus at 46. He's dizzy, alert, oriented times 4, blood pressure 80/60. Your time begins now.
BSI, scene safety.
Scene is safe.
I'm going to go ahead and look at my IV line here, or my saline solution here. I'm going to make sure it's clear. No particulates floating around. Make sure it's not expired. Alright, looks good there. I'm going to go ahead and grab appropriate size administration set. I'm going to go ahead and spike my IV bag. I'm going to fill my drip chamber up halfway. I'm going to hang my line here. I'm going to get rid of any excess air in my tubing.
Hope you don't have hair.
Flush my line there. And I'm going to gather my appropriate equipment here. Got needles, some tape, gauze, IV, or alcohol swab. I'm going to put a tourniquet on my patient, and I'm going to let him know that I'm going to put a tourniquet on him. I'm going to start an IV. I'm going to palpate for a suitable site there. Right, looks good. I'm going to put one right there. I'm going to go ahead and I'm going to clean my site in a circular motion going out. And while that's drying, I'm going to rip off my tape. Alright, I'm going to go ahead and grab appropriate size catheter for my vein here. Making sure your bevel side up is there. I'm going to pull some traction on the skin, and on the count of 3 I'm going to tell my patient I'm gonna poke him. Ready? 1, 2, 3. Alright, I got flashback there. Advance my catheter. Occlude my vein. I'm gonna dispose of this in a sharps container. I'll take off my tourniquet there. I'll hook up my line. I'm gonna open up my line and see if I have adequate flow.
You do see adequate flow.
Yeah, I'm going to bring it back down to TKO.
You still have TKO flow.
I'm going to secure my line using tape and some Tigaderm. Secure the rest of my line.
Alright, line is secure. You're still treating a 6-year-old bradycardic male.
Okay, I'm going to have my BSI on still here. I'm going to go ahead and I'm going to give my patient atropine. I'm going to look at the atropine and make sure it's the right concentration, right dosage, right amount there, and make sure it's not expired.
What is your concentration?
Concentration of atropine is... well, we're going to give 0.5 milligrams of atropine. I'm going to have my BSI on. I'm going to grab my alcohol wipe here. And I'm going to clean the port of my line here. I'm going to go ahead and stop my flow. And I'm going to grab my syringe here. Make sure that's on there. I wiped my line, make sure it's clean, and I'm going to ask my patient to see if he's allergic to any medications.
Your patient is not having any allergies.
Okay. Okay, again, I'm going to make sure I'm giving atropine at 0.5 milligrams. I'm gonna go ahead and I'm gonna administer my atropine. I'm gonna kink my line here.
How much of the vial are you administering?
Half of the vial, because it's 1 milligram, 1 milligram per 10 mils here, or 0.1 milligrams per mil,
Okay.
and there's 10 mils.
All right.
So I'm gonna give 0.5 milligrams of atropine. Got my line kinked. I'm gonna go ahead and take that, dispose of this in an appropriate sharps container. I'm gonna unkink my line. I'm gonna open up my flow.
When you open it up, you have good flow.
Okay, I'll bring it back down to TKO. I'm gonna look for any adverse reactions, side effects, any infiltration, and anything like that.
You have no